Who's crazy? A bizarre experiment in the United States has demonstrated that psychiatrists cannot distinguish effectively between people who are mentally ill and those who are not. According to its originators, the experiment demonstrates that the conventional psychiatric diagnosis may not be perfect, and psychiatrists may sometimes make mistakes. The experiment also lends considerable support to the position taken by radical psychiatrists like R.D. Laing, who argue that diagnoses of mental disease are often no more than convenient labels designed to make life easier for doctors. 8 perfectly normal people, by shamming symptoms of a mild kind, successfully gained admission to psychiatric wards where they remained undetected during their stay. Once admitted, their behavior was normal in every way. They stopped pretending and behaved as normally as they could, but doctors and nurses continued to treat them as disturbed. In every case but one, the diagnosis was schizophrenia. Once they were labeled as mentally ill, everything the pseudo-patients did tended to confirm the diagnosis in the eyes of the medical staff, though other patients in the hospital were much less easy to convince. To gain admission, the pseudo-patients told the whole truth about their lives, their emotions, and their personal relationships, all of which were within the normal range, and lied only about their names, symptoms, and in some cases, their occupations. The symptoms they complained of were hearing disembodied voices saying the words empty, hollow, and thud. This was sufficient in every case for them to be classified as mentally ill and admitted to the hospital. As many as a third of the real patients inside detected that they were frauds. You're not crazy. You're a journalist or a professor. You're checking up on the hospital, was a typical comment from a real patient. The experiment was carried out under the supervision of Professor D.L. Rosenhan of Stanford University, himself one of the 8 pseudo-patients. Writing about the experiment in this week's Science, he concludes, "We cannot distinguish mentally ill people from sane people in mental hospitals. How many people, one wonders, are sane but not recognized as sane in our psychiatric institutions? How many have been stigmatized by well-intentioned but nevertheless erroneous diagnoses?" In Professor Rosenhan's view, the hospital itself is an environment that distorts judgment. As evidence, he quotes what happened to the patients who asked doctors perfectly sensible questions. They took the form. "Pardon me, Doctor. X, could you tell me when I will be eligible for ground privileges?" or some similar request, courteously presented. In almost 3/4 of the cases, the psychiatrist's response was to walk on, looking away. Only one doctor in 25 stopped and tried to answer the question. But the clinching piece of evidence comes from another experiment in which a hospital was warned that pseudo-patients would be presenting themselves. Faced with this threat to their professional reputation, the doctors admitting patients became much more conservative in their diagnoses. Of 193 patients presenting themselves, one doctor was firmly convinced that 41 were frauds, while another doctor suspected 23. In fact, no pseudo-patients had arrived at all.